We are very excited about this phase 1 clinical trial, even though this is a phase 1 clinical trial, but I think we can learn a lot from it. Everyone in the field now, the treatment for refractory and relapse AML really need a new treatment strategy because generally speaking, this group of patients have poor outcome even with stem cell transplantation. So CAR T will be next step. Hopefully, we can get to that. So in this trial, we know that for AML patients, about 30% of patients express CD-7 on their blast surface can be as a target. So in this phase 1 clinical trial, we're using anti-CD7 CAR T therapy to treat those CD7 positive AML patients. So even though we only put 10 patients, however, we can learn a lot. Those 10 patients, one of the requirements is at least to give at least patient to have more than 50% of CD7 expression, and we put both pediatric and adult patient. Median bone marrow blast was 17%, but can be as high as 73%. And in addition, those patients on the median line of prior therapy was 8, and 70% of patients actually were relapsed from previous allotransplantation. So really heavily pretreated, poor outcome patient. However, after the CAR T therapy, 4 weeks after CAR T therapy, do the evaluation, you can see 70% able to achieve the complete remission. And the majority of those are deep complete remission. So we are very encouraged about those results. For the longer follow-up, and some of patients, even up to 770 days, still have no relapse, even though eventually the patient died from the infection from second allotransplantation. And we have other patients doing well, leukemia-free around day 400, and some other patients may, we find to have some early relapse. However, we identify they actually had the CD7 antigen lost. But overall, we are happy. And the safety profile actually pretty good and manageable. Certainly, we need including more patients into that study and for the longer follow-up.